notice made of T2 hyperintense lesion with more than 50% drop in the signal in the FLAIR, suggestive of T2-FLAIR mismatch sign positive. It is cortical bar subcortical based tumor without significant adjacent vasogenic edema or mass effect. Imaging features are favoring for a low-grade glioma. There is no evidence of cortical bulge or calcification, no evidence of multicentricity, necrosis, or hemorrhagic areas within the lesion. In view of classical features of T2-FLAIR mismatch sign, possibility of IDH-mutant glioma to be considered. However, if a CDKN4 mutation is positive, the lesion may turn out to be a high-grade glioma. So the word low-grade glioma itself is a challenging aspect nowadays. Uh, and also we should definitely look at the classical features of any calcifications of serpiginous calcifications to rule out a 19p co-deleted oligodendroglioma. In this case, they were markedly absent. So this is a case of T2-FLAIR mismatch sign positive IDH mutant astrocytoma. Oligodendrogliomas often shows calcification, cortical subcortical involvement. So final reporting line is expansile cortical subcortical T2 hyperintense lesion with a near complete FLAIR suppression and peripheral FLAIR hyperintense rim showing T2 FLAIR mismatch sign. Imaging features are strongly suggestive of IDH mutant diffuse astrocytic glioma rather than calling it as low grade glioma pending molecular confirmation. So whenever you see a T2 lesion which is almost suppressing on FLAIR, pause and look carefully. This is a case of T2 FLAIR mismatch sign, an important molecular clue for IDH mutant astrocytoma.